So I thought it would be good to talk through the pelvic floor muscle exercises. These are really important at this stage after having 2 little ones.
Okay.
So we'll just talk through where they are first.
Yeah.
So this is your pelvis.
Uh-huh.
Okay. So in us, it sits right down here.
Yeah.
Okay. And you've got the hip sockets here, where
Okay.
your leg bones come out of.
Yeah.
So the pelvic floor sits exactly where it says it does, at the floor, the base of the pelvis.
Yeah.
So that's where it's positioned.
Okay.
And we've got sort of 2 sections that make up one muscle.
Yeah.
Okay, so you've got a deeper section and a more superficial section. So because we've got these 2 sections, the way we want to actually exercise these muscles is, first of all, and I want you to practice these now.
Yeah.
Okay. Great time is when you're feeding, so this is a good kind of time to be thinking about it. First of all, try and imagine you've got wind and you don't want to pass out your back passage. So you're going to try and squeeze around your back passage and hold in wind.
Yeah.
Can you feel that section working?
Yeah, I can.
So that would be these deeper muscles sort of starting to work.
Okay.
Okay. Just first of all trying to think about holding wind, and then also add on to that trying to hold urine in as well. So you're thinking more around the front.
Yeah.
You're squeezing towards your pubic bone. So thinking holding wind, holding urine, and then letting it relax. Can you feel that working?
Yeah, I can.
Excellent. So that is your pelvic floor.
Okay.
What's a really important key thing to think about is the muscle fibres, they come from the base of our spine forwards to the pubic bone. So the way we want you to do them is we want you to initially do some where you're not trying to hold a contraction, but you're just trying to squeeze the muscle, relax the muscle, squeeze and then relax. They don't have to be fast. They're just trying at a steady pace, and we don't want you to flicker.
Okay.
We want you to go a full contraction and a full relaxation.
Yeah.
Okay, and you try and do 10 of those in a row.
Mm-hmm.
Okay. You then move on to try and do some where you're trying to hold a contraction, so a slow contraction. So try now to think about holding wind and holding urine.
Yeah.
And what you want to try and do is hold it there for a count of 10 seconds whilst you breathe in and out.
Okay.
How does that feel?
Yeah, it feels okay. I feel slightly like perhaps I've got more control over the back than the front.
Yeah, that's very common and what women often express. And that's because obviously the muscles where you've had an injury and that were affected during the birth are around the front, more so than the back.
Okay.
So that's very common feeling,
Yeah.
and that just means the front we just need to continue exercising to get it stronger.
Okay.
What was a really nice thing is when you were doing that exercise then I couldn't see any movement of your body, and that's exactly what we want. So we don't want any movement of your bottom, so you feel like you're moving up and down the chair, no movement of your legs, and no movement of your tummy kind of going in, trying to pull up your pelvic floor as well. Okay, so it's just isolated around the pelvic floor muscles. That's exactly what you want.
So you should just be able to talk through it.
Absolutely. You should be able to hold them as you breathe and you talk and you do other things.
Not doing funny faces. Or
exactly. The concentration. But it does take concentration initially, especially if you've had a tear and an injury.
Mm-hmm.
And we'd recommend that you get going on these straight away after you have your baby.
All right.
If anyone was to have a catheter,
which
is what you would need sometimes to help urine come out of the bladder.
Right.
If you've maybe had an epidural or something like that, we wouldn't want you starting them until you've taken the catheter out and passed urine.
Yeah.
But you can absolutely start them on the day you've had your baby if all of those, or the day after if all those things are cleared.
Okay.
And it actually can help for someone like yourself who had the tear and some swelling.
Yeah.
If you get the muscles working, it actually can help pump some of that swelling away and take the pain down.
Okay.
So pelvic floor is brilliant. It's absolutely fine to start even if you've got some stitches in.
Yeah.
So the pelvic floor muscles are important for so many things. They've got different roles.
Yeah.
So they help stabilise our pelvis.
Okay.
They actually keep our pelvic organs in place, which would include our bladder, our womb and our bowel.
Okay.
And they prevent what we would call a prolapse, which is what can happen. It can happen after childbirth, or it might happen in later life, where your bladder or your bowel, you maybe drop down into the vagina, which can be quite uncomfortable and painful.
Yeah.
Or give you symptoms such as leaking urine when you cough, sneeze and laugh, or when you're on the way to the toilet.
Okay.
Your pelvic floor keep you continent of urine and faeces.
Yeah.
And they also allow us to have sexual pleasure. So they're very important muscles.
Yeah.
And really important for now, but really for the rest of our lives. And as women, we should be doing these all the time. It's not just for pregnancy and postnatal period, it's all the time.
Yeah.
So I really encourage you can get into a good habit now, but to continue it.
And it's okay to start whenever, because obviously it will build up over time.
Absolutely, yeah, completely. You can always want to start them. If no one's ever done them before, it's always good to start and then build on them.
Yeah, because to be honest, I hadn't really done them before having a child.
Then there's no time like the present to get started, and this is a really good time in your life to get into a good habit.
Okay.
Great.